I'm Vernon Burke. I'm an oral maxillofacial surgeon here at UMC in High Desert Oral and Facial Surgery. So most commonly, what I do is tooth extraction and sedation. For hospital-based surgeries, then my clinical focus is on jaw moving surgery, or what's called orthognathic surgery, trauma, facial trauma, both soft tissue and bony. And then I do some hard tissue or bone, cleft lip and palate surgery. The type of practice that we have here in El Paso is one of only 3 or 4 in the country that are similar. That most of the time these services are scattered around, that there's a surgeon who will do some TMJ surgery, or there's a surgeon who will do jaw surgery, and then there's a surgeon somewhere else who will do head and neck cancer and microvascular. To have all those services in one practice where the surgeons in the practice can collaborate on the more difficult cases is actually extremely uncommon. When I arrived here, there wasn't anybody who was doing a large volume of even jaw surgery. So it was shocking that there wasn't someone who was addressing that need, one of the most common things that we do. So you can imagine that things like cranial vault surgery for children, cleft lip and palate surgery, head and neck cancer and microvascular, TMJ surgery, all those things of course were not being addressed. So that kind of need where there's such a deficit in the surgeon that the children are just going without care. When I was in high school, I wanted to be an electrician, and I went in the Navy and I was an electrician's mate and was aboard USS Long Beach. While I was there, I saw that people who had college degrees seemed to get treated better and had better food. So I decided to go to college after I got out and came to become a nurse. And I worked in the pediatric ICU and then adult critical care trauma. While I was doing that, I was considering going on with my education and met an oral maxillofacial surgeon. And he sort of inspired me to do this. He was by himself in his practice, and I saw all the things that he did, and so I wanted to do what he did. I am personally not brave about going to the dentist, so I'm sympathetic to that. And I understand that what we do is scary for most patients. Some people have had a bad experience, some people are worried, and so we offer, first of all, professionalism, expertise, and so things can be done timely and efficiently. The other thing is that we offer sedation techniques that help a lot of people get through a procedure that they find scary, and they don't necessarily have to be aware of it while they're having it done.